G'day, it's Graham Healy from Healy's Lower Back Care and Healy's Musculoskeletal. Tonight is going to be a video on calf pain or gastrocnemius pain or soleus muscle pain. And we'll go through that and explain how we can solve the situation with dry needling. Now, I'll just take some of these layers off so you can see. Right, 1, 2, we're just taking it back to just the skeletal system. Now I'll put some arteries in there. Now the program we're using, as we say all the time, is The Complete Anatomy by Elsevier. The link is on our website. We highly recommend that you subscribe to this software. I consider it the most professional and best software available today. And if you, even with clients, showing them what you're actually doing with the dry needling, I usually use this software to break the muscles down and show them where the, nerves and arteries are and exactly what we're doing with a clear explanation. Now, arterial, we're going to add in the main artery there, and we just have a very close look at this. Now, of course, this is the popliteal artery. Of course, when we go further up the spine, this is actually part of the femoral artery. So what happens is, you can see this a bit clearly where that comes from, the femoral artery, and that basically feeds in the common iliac artery, goes further up the chain. But it's generally the same vessel, but it just has different names as it travels down the anatomy. So, it'll start, as I say, it'll start here, external iliac artery, then it'll go to the femoral artery, and then behind the femoral, when it goes behind the knee, it's called the popliteal artery. You can actually take the pulse by putting your fingers at the back of the knee. And this is an area here that, as far as dry needling concerned, you don't go anywhere near that area there. So as they say in the dry needling terminology, they use the Chinese terms of 3 chun or 4 chun, which is 4 finger widths across the back of the knee. You don't go anywhere near that for obvious reasons. So as we look down towards the tibia, which is, I always say it's T for thick. The thin bone, of course, is the fibula. So you got your tib and your fib. Now, just have a look at this popliteal artery. As it goes down further, it's called the posterior tibial artery, right? Posterior tibial artery. And of course, then it goes underneath the foot. But as I bring that around the side, it goes very, very close. If you can see that, it goes close to the fibula bone. But when we put some muscles in here, we will see what happens very shortly. So just one moment, we'll add some muscles in. So you'll see there we've got the tibialis posterior muscle. And you see as I increase the why is this important? You'll find out very shortly as regarding dry needling. Now see how the posterior tibial artery runs along the surface of the tibial the tibialis let's repeat that again, the posterior tibialis muscle, right? So that sort of fills the gap between the fibula and tibular bone, and usually the arterial system, the venous system, and the nervous system will run in little bundles all together. Okay, now just keep that in mind, and we're going to add in a very important muscle next. So we just go to muscular. Remember to subscribe to this software called The Complete Anatomy by Elsevier. The link's on my website, and everything that I do here has always got that link so you can subscribe. Now, let's get this a little bit so you can see what I'm doing here. put that in perspective. The back of the knee, right? I won't worry about, well, we're putting those muscles on there, but they're not relevant to our speech. Fibularis longus muscle. That's also, look, we can dry needle just about every muscle in the body. That's one we also dry needle, but we're not focusing on that tonight. Now, we'll add in a little bit more muscle going in there. So you've got the flexor digitorum longus. So that muscle flexes the toes. I'll just separate that so you can have a look at it. Right. The whole muscular system, as you see that the flexor digitorum longus, you see the tendinous tissue connect to the metatarsals here. The whole muscular system is like a set of cables. So the muscles pull on these cables, slide backwards and forwards, and that's how the whole thing works. But anyway, that's not one we want to exactly focus on either. We're getting there. We'll add one more layer of muscle in, and here it is. This is the, people see the gastrocnemius, but the biggest, strongest muscle of the calf area is the soleus muscle. Now, this is one, if you're a runner or a cyclist, or even you're just walking the dog for an hour or something and you get calf muscle pain, and I'll describe a little bit of calf muscle pain that, like I'm turned 70, I'm semi-retired, but I'll describe a little bit of calf muscle pain that I've been having lately. And, I've got to treat myself. So I'll describe exactly what I did in a second. So when you see this the soleus muscle, it's the big kahuna at the rear or posterior of your tib and fib. Now, this is the one that we can needle, but there's a special way to needle this particular muscle. Now, when I remove it, and we've got it on the side, the lateral side there, yes, the lateral side. So I'm going to hide that. And remember what I said? Here, you've got the posterior tibial artery. Now, there's a few muscles that we've added in there, but primarily it was sitting along the posterior tibialis there. All right, and I'll just isolate that so you can see that. Posterior tibialis, the posterior tibial artery basically follows down here, then runs across the ankle. So we've got to avoid that. And how we avoid that, as I put on the muscles again, let's whack the soleus back on. Now, you see that from the side? So when we measure this, I'm just show you the principle. When we measure this, you'll see the edge of the tibia, the thicker bone there. Now, we go right to the edge, so we know that the edge of that particular bone, the tibia, just parallel to that is the posterior tibial artery, which runs along the posterior tibial muscle, right? So when we remove that again, I'll just remove it just to hide it for a second. And hopefully this is clear. The tibialis posterior is what I'm trying to say. So you see the posterior tibial artery as it sits there, it sits right on top of the tibialis posterior. Now, when we put the soleus back on, add that back on, boom. Now, what we do when we dry needle, the actual needling point's about here. When we add on the gastrocnemius, which I'll do in a second, which sort of sits out right out there, we measure from the edge of the tibial bone back to the rear of the gastrocnemius and halfway. So about there is where we needle the soleus muscle. And we do that actually, that's the external. We do it from the inside. In other words, medial. We go from medial to lateral. And this, when we do this, you'll be amazed at the relief you get, whether you're a cyclist, whether you're a sports person, rugby league or whatever. Those calf muscles cop a hell of a hammering. And you've got to remember something, that the calf muscle is actually, it's the mechanical heart of the body. In other words, as far as the venous return system, the calf muscle squeezes the venous return and squeezes blood back to the heart, right? Arterial system's got its own muscles, but the venous system's only got a set of valves. So it's got a set of valves going backwards towards the heart. So the calf muscles, the soleus and the gastrocnemius, when you walk, it actually squeezes the venous return. So when it squeezes it, it's got, basically valves in the venous vein system, and it squeezes the blood, the return blood, back to your heart, and then that goes back to your lungs, gets refreshed, and then comes back through the artery. So that's why it's important to get up and walk around. If you've got an office job, walk around so that you use the gastrocnemius and the soleus part of the leg to pump blood back to your heart, basically. Right? So, okay, that's just a little side issue. Now, you see the soleus there. You see on the medial side, which is the inside of your leg, is where we needle it. Now, when we do that, we pull that muscle right back. So we use what we call is a clamp. It's a clamp with your fingers. Basically looks like this. Can you see that? So I clamp them and pull that muscle down. If you can see the clamping effect, it's a clamp grip. So we pull that muscle right off the bone, and then halfway between here and the gastrocnemius, we actually needle the soleus, and we'll catch us a little bit of the gastroc as well, but that's okay. Now we'll put on the gastrocnemius now. Right, see, the gastrocnemius is what you call the pretty boy that sits on the posterior side of the soleus muscle. See the soleus muscle? Then, of course, this whole setup is attached via the calcaneal tendon to your Achilles tendon. So, this is what operates your, when you walk, this is what operates the foot going up and down, so to speak. Okay, so now, all we need to know here with the gastrocnemius is there is a nerve that travels, and I'll try and get that nerve. We'll just go a bit closer. Here it is. It's called the cerebral cutaneous nerve. It sits down the middle of the gastrocnemius, right? So when we needle it, we needle the gastrocs around about here as the trigger points, and here, and the needle goes from just off center outwards. So we sort of, let's say if I go onto the side, the needle will go outwards. Sorry, that's moving around a little bit. It'll go from here, from the middle, or possibly the middle out towards laterally. All right, and the reason why we do that is there is the cerebral nerve is traveling right down the middle of that gastrocnemius. So we needle here and here. I'll remove this. Let's see. Here we go. We'll remove the gastroc. And I'll hide. Let's remove half of it. We'll remove the other half as well. Hide that. Lo and behold, there it is. There's the soleus muscle. So that's the main driver. You think, the calf muscles, you see the gastroc, and you think that's a calf muscle, where there's two muscles operating here, one sliding across the top of the other. And there's tendon tissue that hangs onto them. So I'll just repeat exactly what we do again. Number one, the needling, the dry needling, when we do a clamp grip and pull that muscle away from the fib. Yeah, sorry, the tibia. Sorry, I get confused sometimes. The tibia, we pull the muscle away from there and needle halfway is around about there. And then when we put on the gastrocnemius, that's a different way we needle that. So we do them separately. Now, here's a little story. If you can see that, I might do a little bit before I finish up. But here's a little story. Now, I've had a few issues myself with cramping of the calf muscles, etc. A little bit of a story there. But today, I couldn't, I was limping with that right leg, right? So I took, and there's a blog I've done on this as well. So I took Caruso's. I recommend Caruso's powdered magnesium. Magnesium relieves cramps, right? The body needs magnesium to stop cramping. So I took a teaspoon of Caruso's magnesium in about 100 ml of water. Then I bought some oil of magnesium and sprayed it on the calf muscles, rubbed that in, and that gets the magnesium in topically. That works quite well as well. Then I needled my own calves. So especially the soleus. So I needled the soleus, and I'm telling you, I went to bed for about, 1 or 2 hours, got up, and the cramping was all gone. So when you come to see us, we're basically specialists in dry needling. Let me just separate this so you can isolate it so you can see that where that gastrocnemius connects into. See it? It goes above the knee and it connects behind the fibula here. So it's a very, very important muscle. So it's part of tying the back of the knee together. So that can affect, knee pain and everything. So there's a whole lot of issues. I'll go through these, important parts of the anatomy separately, but you just can't cover everything in one video. So, okay, those that are that are cyclists, those are rugby league players or whatever, or if you're a runner, and you're hammering that gastrocnemius and the soleus muscle, or even if you have Achilles heel pain, or even if you have plantar fascia issues there, right? And I'll just remove this. Let us hide that one. This particular, the quadris plantae muscle is a real problem. And while I'm here, I'll just describe that to you, that we can needle through from here, which is the abductor halus, basically. We go right through to about in the middle of this one. And we can take away all the plantar fascia pain as well. Now, I'll do a separate video on that, but I just thought I'd mention that as we're talking about the gastrocnemius and the soleus. Okay, so that's the procedure. Please contact me and I'll tell you from experience doing it to myself that those calf muscles will be within 24 hours that the pain and everything will reduce by, I'd say, 50, 60, 70%. In my case, it was about 80% in about 2 hours. The soleus, when you do the soleus, it may take overnight. It may get a little bit sore because that's, especially if you're an athlete, that cops a lot of hammering. And it may be sore from the needling for about, possibly 4 to 6 hours. And then boom, hey presto, it's like nothing ever happened to it. I'll give you one more example before I finish up. I used to work with a very good acupuncturist who did know dry needling as well. She was a doctor in Beijing in China. Those days I was running personal training and we were doing the sprints up and down the Kangaroo Point stairs. I was doing sprints up and down the Kangaroo Point stairs before anyone else was actually doing it. And then suddenly there was people doing it all the time. We couldn't get room to doing it anymore. But anyway, on this one particular Saturday morning, I was doing a lot of sprint work It was a few years ago now, and I finished my sprint work. When I got back up into the car, I think it was the right calf muscle just spasmed like you wouldn't believe. It just went in complete agonizing pain. And I mean, I couldn't hardly drive the car. It was that painful. And I thought, what am I going to do now? So I contacted Joan. I can't remember. Her Chinese name begins with Z, so we couldn't pronounce that. So she said, just call her Joan. And I went into her clinic and I said, look, hit that calf muscle immediately, please. So I spent 20 minutes in there. And guess what? As soon as I walked out, as she dry needled that calf muscle, doing both the soleus and the gastrocnemius, 100% okay. Now, had I not done that and relieved the muscular spasms, that would have been an injury that would have held me back for a couple of weeks before it naturally settled down, and I would have been in excruciating pain that night. So that's the power of dry needling. Hope that helps. I'll load this on the website, and we might do some Facebook ads with this as well. Okay, Graham Healy over and out. Have a great day. And remember, dry needling is really, I've found it, I specialize in dry needling because it just works that well. It works better than any other modality that I've seen. And I use it on myself as well. So, okay, have a great night. Thank you very much for listening.